a traditional practice to a concierge model 6 years ago, what have you enjoyed the most?
Well, mostly I enjoy spending more time with my patients. It's a great privilege to have more time during our visits and more opportunity where the patient and I can really strengthen that doctor-patient relationship. And I think that helps the patient feel more at ease, able to share their personal stories, their symptoms, their stresses, their home life, their business, how it relates to them, so I get to know them better. And I think it also helps me feel more connected and engaged with the patient, so I can be more thorough and be as caring as possible, feeling that connection.
Can you share a success story that otherwise may not have taken place without the environment that Personal Care Physicians provides?
Well, yes, there was one of my patients, a nice lady who lives about 50 miles away, had called with a worsening lung condition and shortness of breath, and she didn't want to go to the same hospital that she lives near where she had a bad experience. So we were able to see her the same day, which works well in our practice, where on average we see maybe 5 or 6 patients in a day. And through my exam, we were able to coordinate also an x-ray next door and some blood tests, and send her home the same day with some treatment. But the next day, when she was feeling about the same, I insisted she come in to be checked again. Her lung exam was worse. So I helped admit her to the hospital and coordinate with her heart doctor and a lung doctor some perfect care for her.
What is one thing about practicing medicine that most people don't know about or would be surprised to hear?
What surprises patients is that medicine is still truly an art. After all these years, the science is important, but there's so much to it. It's more than just the science. As doctors, we strive to use evidence-based medicine and choose the best treatment based on a test result or for a patient. However, the art comes in where you really have to know your patient and individualize the treatment based on my patient's age, ethnicity, their gender, the medications they take, their other medical conditions. There's really a lot more that I have to be able to juggle between different contradictory studies and different research. And it works the best if I have the time available, the knowledge, and that relationship with my patient where I can individualize their treatment the best.
Thank you, Dr. Bloom, for joining us today and being a part of Personal Care Physicians TV.
Well, thanks, and I hope people have learned a little bit more about me.